time is valuable. I want to give a little background on what this Boomerang, we get some questions, what is a Boomerang? And two members of our entrepreneurship committee are on the call here. Doris Lux is our chairman, and then Shay Spitz is on as well. They are both members of the entrepreneurship committee. And their discussions have been, how do we help businesses? How do we connect them together and have conversations? And so this is probably the second one that they've done. The Chamber has done a webinar. We did it initially with Chuck Sepers, who's on the call as well. And our other guest speaker, Scott Moore, is also visible on the screen if you can see him. And we've had a few of these calls. We had one more for industry, one more for more of a global panel, and then we've done some miscellaneous ones along the way for targeted audiences. So this one has a variety of business members. We've had some questions on liability. And some of you may have participated in the employer forum that the Columbus Community Hospital had. And Scott Moore was one of the presenters on that, did a wonderful job. A lot of people had really good questions, and I think he fielded them very well. And so on behalf of the Entrepreneurship Committee, I guess we are very grateful to have him as a speaker, as well as always set the stage locally with Chuck as our kind of our anchor for the broader discussion. And so before we turn it over, and I'll introduce each one of the speakers here, our Entrepreneurship Committee, Doris or Shay, would you like to say anything to the group?
Well, I'd just like to thank everybody for coming to this workshop, and on the Entrepreneurship Committee for the Chamber. Our goal purpose is to help and assist small business, entrepreneurial businesses in the community in whatever direction we can. And with the virus, we felt this was a good opportunity to share the knowledge that we have today that's going to be speaking to us. So thank you for attending.
Shay, anything more? Do you want to just wait, at least let them know?
I would just say that, I mean, if anybody has anything specific to your business, please ask questions, because we don't know how to help everybody. So just be sure to reach out, ask questions throughout this interview, I guess you could call it, but definitely don't hesitate to ask questions.
And we had some questions on just the protocols. If you want to unmute yourself when you have a question, that's great. We'll get to a Q&A period. Otherwise, if you want to mute yourself, that gives the presenters the floor for them to talk a little bit about, or not a little bit, we're going to have them talk about what is happening. And so we'll first start with Chuck Sepers, and I'll introduce both of them so you get a framework for why they're both in the room. Chuck Sepers has worked to improve our social environmental policy environments for the last 15 years within communities. He has a bachelor's degree at the University of Nebraska-Kearney. He's completed his Master of Arts in both behavioral psychology and Master of Public Health at the University of Kansas. He's currently completing his PhD in behavioral psychology with an emphasis in community health and development from the University of Kansas. And his research is focusing on federally qualified health centers as a public health strategy. His hobbies include spending time with family, outdoors, and walking his dogs. And for being on Zoom meetings where people have their dogs, a little side note, it's nice not to have, if anybody's been in those Zoom calls where the dogs are barking. So, but it also speaks to Chuck's not only his experience in leading us and helping our community through this, but also I'm interested in the behavioral side, because that's really the crux of human behavior, consumer behavior, business owner behavior on how we open and protect our customers and our employees. One more presenter here today, Scott Moore, Scott S. Moore. He regularly represents employers in various industries with respect to labor relations and employment matters, including personnel policies and decisions, labor negotiations, preventive planning, immigration, workplace investigations, and workplace safety, equal opportunity in defense of employment-related claims. He's represented employers on labor and employment matters throughout the United States, and he received his Juris Doctor from the University of Nebraska College of Law with high distinction in 1992. This is, I just am very impressed with him. He's one of the very few employment lawyers regionally who is a fellow of the College of Labor and Employment Lawyers, the premier peer-selected organization of labor and employment lawyers in North America, which is an admission-only process. He also, I thought this was interesting, coordinating, providing direction for multinational downsizing. So one question that we've received from at the chamber is workplace and how it's changed. People are working more from home. So what does that mean in terms of the infrastructure, the brick and mortar? What will that mean in terms of sizing of companies? So we have a large gamut of discussion points, primarily focused around phase 3 versus phase 4. We've reopened, Scott, in our community. We have a lot of restaurants that have opened their doors, and they have made accommodations to make sure their employees are safe, educating their consumers. But we do get questions on why might one restaurant do it this way and another do it that way. I know Chuck's staff has fielded a lot of those calls as well. So, and then how do we transition from where we are into phase 4, or God forbid, what if we go back to phase 2? What does that mean for us as a community? So we'll first set the stage. Chuck, if you want to give us a pulse on where we are with our COVID cases and what you've seen in the community from the businesses as well as human behavior, and then we'll open it up and have Scott give us an overview of what he's seen and what types of liability issues might be on the forefront for businesses to be aware of. How's that for a long introduction?
That sounds great. And this, just as a fair warning, this may be one of those Zoom calls where you hear a dog in the back. So do apologize for that. Jeannie, if I could get, let me see, if I could get share access, I can walk us through some data. Find things are always better with data. I'd also like to add to that too. We might also spend a minute or two talking about tools that we're working on for easier decision making here at the local level, kind of giving you the tools that you need to kind of think through some of these topics.
Okay, you should have access now, Chuck.
Okay. All right. All right. So we are working on a data dashboard that will sort of automate some of these processes, but just wanted to kind of give an overview. We think about things at a 4-county level, our jurisdiction, but if we want to focus on Platte County, so these data are fresh as of last Friday, and we'll talk a little bit about where we are in terms of trajectories, but cumulative cases. Here's an interesting fact that folks don't often consider, is that in the grand scheme of things, the East Central District, which composes Boone, Colfax, Nance, and Platte counties, we had about 87% of the total cases that Lincoln Lancaster had. So that's a pretty considerable statistic if you consider where we are. Thinking about things like positivity rate as a metric for understanding where we are and sort of the safety of things, it's rather high, right? So which is so for Platte County we're looking at 22.5%. That you have to take that with a little bit of a grain of salt. That really means that of all the folks that we've been testing, about 1 in 4 have been positive. However, up until this point, we've been testing largely symptomatic folks. So those that have COVID-like symptoms have really been the target in the absence of a really widespread, robust state strategy. So that's changing. There is, and you probably all have heard of the Test Nebraska project. That's the state's mass testing project that was brought online to help bring about population level testing, which is really so critical, right? So part of the strategy nationally, and you hear these these pieces about a particular state is safe to reopen or it's not safe to reopen. That's really dependent on a number of factors, one of which is positivity rate. So really the strategy with driving down positivity rate is to increase the number of tests that you conduct. So more aggressively looking for COVID infection and not finding it. So both things are pretty important there. So I'll just kind of highlight in this report. I'll just go down. If you look at so in this graph, we're looking at the 7-day average of cases, and this might be kind of hard to see, but blue is Platte County, and so Colfax and Platte County are about the same. They're statistically similar here the last few weeks, and we're averaging about 2 or 3 new cases in the health district. It kind of goes back and forth between if the cases are coming from Platte County or if they're coming from Colfax County, kind of back and forth. But you can see this trend has been going down pretty considerably. And if you look back over the last month, it's dropped quite a bit. It's been a bit of a plateau if you consider the last 2 weeks, which is a decision point. But largely has largely improved here in the last 4 weeks. So that's really good. And if you want to consider the total, what we would say active cases in the last 14 days. So those are the new labs or new positive cases that we've had in the health district over the last 14 days. You can see that that trend has dropped dramatically, and so these are pretty encouraging data. This combined with our positivity rate going down is something that's really exciting. I also just want to take just a second to preview. We've been working on, in fact, many of us in the state have been working on a risk assessment dial, right? So again, talking about those tools to get you the most up-to-date, information about where we are and what does it really mean. Okay, so thinking about risk in terms of these 4 sort of stratification levels, so green, yellow, orange, and red, and what that means. And so we have a very diverse district, both economically and ethnically, racially. It's a every county is very unique, and so we want to consider that in our health risk assessment through this dial. And what accompanies these dials, and I'm giving you all a bit of a preview. These aren't even up on our website yet, so this is something that we'll be rolling out either over the weekend or on Monday. And what accompanies these risk dials and what we will expect to have you see is there'll really be a set of guidelines. This is really small, and it's just to illustrate rather than to go into specifics on this. But at each risk stratification, this will provide information about recommendations from the health district about what should be done at particular levels, right? So we're currently at a level yellow, and so it means a number of different things. It it also prescribes a number of different things, right? So, so for example, face coverings are strongly recommended for anyone over 2. You know, we're still seeing cases. We have a extremely high positivity rate, which either means that a lot of people have COVID, which we know from other indicators that's not really the case, or that we haven't tested, you know, enough, asymptomatic folks. We're starting to see now in the, you know, nationally that as many as 75% of people that that are COVID positive do not have, or sorry, are actually asymptomatic or do not have you know, symptoms. And so because of that, mask wearing is a pretty concerted strategy, something that we know to be very low cost and very effective at stopping COVID. And you'll see that recommendation throughout these different phases or risk levels, I should say. And, you know, that'll, you know, until we have a vaccine and we know that we can, you know, effectively get to a point where, you know, we feel comfortable having people within 6 feet without a mask, then, you know, mask wearing is going to be something that's going to be pretty, you know, integral to our health district strategy for stopping that spread. So this is coming online. Again, this is just more of a preview. And then talking about the DHMs and the phases. So as Jeannie had said, yeah, we're at phase 3. We were actually scheduled to begin phase 3 yesterday on the 1st. And so the fact that our timeline has moved up a little bit on that, that's a positive thing. I think that we were ready for phase 3. There are some health districts that are moving into phase 3 next week. But we did move into phase 3 about 1 week early. As of right now, phase 4 is scheduled to begin August 1st. But if we've, you know, if things have kind of kept their course, we would expect, you know, Governor Ricketts to actually recommend moving to phase 4 just a little bit sooner. You know, so one of the questions that we often get about the DHMs are what sort of dictates moving between phases, and so you'll see some health districts, you know, again are in phase 2 right now and are moving into phase 3 next week. That's largely determined by the sort of local capacity in the local healthcare system. So that is hospital beds, that's ICU beds, that's ventilator, you know, availability, and those things. And you know, with that, we do have quite a bit of you know, capacity, and we've got a great, robust local healthcare system, and you know, those we have a lot of capacity there. So that's kind of what that looks like. So this document just kind of highlights, and I can send this to Jeannie if you don't have it, Jean. But it basically describes at a 30,000 foot view what are those differences between phases 3 and 4. So again, the scheduled date for phase 4 is August 1st, as we see numbers continue to improve here in the health district. And basically all of the you know, restrictions that are in place at different levels are moving from restrictions into guidance, right? So so for example, bars, taverns, gentlemen's clubs, and bottle clubs have a maximum of 8 person you know, in a party. That's changing into guidance, right? So that's already outlined in a guidance document. That won't be mandated through the DHM, but it'll be moved to. You know, another thing that comes up all the time is the salads and the salad bars and the self-serve you know, buffets. That's something that'll move into or that's coming off. And so you see some of those very specific things There are some, regulation-based things related to childcare centers, and that's moving to the maximum allowance per license. The gathering, regulations will loosen up quite a bit in phase 4. So you see indoor is at 50%, 75% in phase 4, with 100% of the rated capacity for outdoor, and that kind of thing. So you see some of these things, and I won't go over each point, but I'll just I'll leave this here for a conversation. If there are specific questions about a specific sector, we can dive into that a little bit more. I think that's a pretty good overview from me. And I don't know if we wanted to move to questions now or if we wanted to wait till we got to the Q&A section.
Well, I'd kind of like Scott, if I'm directing this ship right now, I'd like Scott to give a little bit of an overview of what so that we've received the local image of where we are in terms of numbers and kind of set the stage of where we are through phases. But if Scott, if you would give a perspective on, where you work and kind of what you're seeing, and what are some of the business challenges that have been brought to your doorstep, and if we'll see if that marries with what Chuck and what the community as a whole on the call here has experienced.
Great, that sounds great. Thank you for everyone for attending, and great to get your information. I've got questions for you when we get to Q&A, so it'll be fun to do that. Gosh, I guess where I'm at is watching employers both locally and nationally. Your data is great there, and that your chart is steadily going downward, it looks like. That's not necessarily the national data. If you go on the CDC's website or go to COVID tracking, some of the national information, especially out of some higher risk states, California, New York, Texas has had a rebound. A number of states have seen an increase in new cases and kind of reverting backward, which is maybe a little bit of a problem for them. And so we're seeing organizations kind of revamp, if you will, their seriousness with regard to their infection control. I think what's unique about all this for employers is, if you had asked me 6 months ago if we were spending our time as employers in infection control, that's probably not where we would be, where I thought we'd be putting our time, but that's exactly what we're doing. And so the advice we're certainly getting from the organizations that help us with all that, both nationally and locally, is absolutely critical, and also the standard. So what we're starting to see now is, schools trying to plan for how they can bring people back in some fashion to protect them. I think we're all scrambling for data as to what is risky and what is not. If you think back just a few months, we were told don't touch our face and don't touch surfaces, and that's how this all spreads. And now we're hearing more that it's going to be vaporized. And so masking is of critical importance. And it seems like every day we get a little farther forward on more and more accurate data as we learn more about the virus. And so with that, we learn more about, as employers and businesses, is what we can do to protect our customers, what we can do to protect our employees, what we can do to protect ourselves, so that we can function and operate and grow and generate some revenue while having everyone around us stay healthy. So in this phase we're in now, which I calling more of return to work, you've had some folks that were critical infrastructure and operated pretty much full capacity throughout. If you were in a factory setting, several offices spent time with remote operations, and we're seeing some return to work on that. And we're starting to see more dialogue about where our liability might be. And so I'm watching nationally as we see cases come down, and it's, for me, as I read those cases, it's really about employers and businesses complying with the infection control standards. So when you go to the CDC site and you go to your local site to look at what you can do for infection control of your business, that's what we're being judged upon. And so the cases are largely, they fall into chunks. Some of them are workers' compensation cases. We know that if an employee brings a claim in most states, it's isolated to just workers' compensation. And so we're seeing claims around that as to whether I acquired it at work, whether I can prove that it was obtained at work, whether it's related to my work, and therefore there's a possibility of a workers' compensation claim. Generally, that's a difficult claim to bring because we know with infectious illness, we don't know where it comes from. It's tough to kind of pinpoint where the event might have occurred, if you will, the transaction of infection. So generally, that's a tough claim to bring. But we do see it in some industries, such as maybe I'm working in the COVID unit at the hospital. I'm screening patients day in, day out. And some parts of my team eventually come down with COVID. I don't acquire it in my house. It's possible that's tied to the workplace and therefore a workers' compensation claim. For the vast majority of us, if you have an employee who ends up being positive, it's probably not the case. The other area is trying to circumvent the workers' compensation claim or claims by, say, patients or customers or visitors to our operation who want to say, gosh, we're negligent in not keeping up with our infection standards. We see a number of workplace claims along those lines right now, a number of them in meatpacking plants, saying that the employer operated with such reckless disregard that the workers' compensation doesn't have a limit. And so they can circumvent workers' compensation and bring their private action, oftentimes in a class action type of claim. We're seeing some of those by family members. My father, my spouse acquired the illness, they passed. The reason they acquired the illness was because poor infection control at the workplace. Therefore, they're bringing that, what I'm going to call negligence type claim against the employer. And those have virtually no caps to them. And so those are fairly large claims. You probably see on a national scale and some locally of legislators discussing, do they put some legislation out there to prevent those claims? There's an open claim in the state of Iowa right now brought against the meat packer. The headlines that they're running and some of the op-eds are, gosh, this is an example of why you can't put limits on it, and they're trying to paint the picture that it was a bad infection control environment. But largely the standard everyone's being evaluated on there, again, is that CDC type standard for infection control. So using those standards for your own operation is pretty critical. The other area we're seeing the claim being brought is under nuisance claims. So this is something you might see like in a pollution case, where because of the business's actions, there's a public nuisance and brought to a broader group of the community. And so we've seen some broader nuisance claims brought. Missouri recently, there was a dismissal of a nuisance claim where the court said, gosh, that isn't applicable here. And as an employee, you have opportunities to bring your complaints either through an OSHA type claim. You can bring your concerns there, and they're following certain safety standards and the CDC standards for the most part. If you go to the OSHA website, they have very good information. They're tag teaming with CDC on that information to get out to you for a safe environment. Likewise, the workers' compensation is available, and the judge kicked it out. In a couple other states, they've let those cases go forward. In one case in California, so it may not apply here necessarily. They essentially shut down the operation and required them to revamp in accordance with CDC guidelines before they could reopen. So not only did they let the case go forward in terms of liability, they also introduced a restraining order that shut down the operation while they had to clean. So those are some of the ways that we see folks bringing their claims. And again, the standard, it seems to me, if I'm operating a business, is looking to those CDC standards for infection control and making sure we're following to the best of our ability. As employers, the things we're seeing right now are really around maybe people fearful of returning to work and having to communicate. There's really two sides to the pandemic as I see it in workplaces. One is the actual illness itself and infection control, and the other one's kind of the pandemic of fear and folks not wanting to return to work or leery about coming to work. And so it requires that we put together a very solid communication plan with the employees and with our guests and our customers, letting them know all the precautions we're taking so that they can feel comfortable. Now, ultimately, if someone refuses to show back to work, we know the unemployment benefit is extremely high until the end of July. So if you've had folks on furlough and now they prefer not to return to work, to the extent that you've given them all that communication and assurance about the safety of your work environment and they refuse to return to work, that's their choice. It will then be a resignation and the unemployment claim will cease. But that large dollar amount has motivated lots of folks to want to stay home. And so we see a decent share of that scenario. We also see people who fail to comply. We kind of have folks on two ends of the spectrum, I'm going to say. Some are in quite a bit of fear about being in the workplace or being out and about, and some are disregarding it altogether. So we may have for example, a masking requirement if you're going to be in common areas, which I think would follow. We can ask your folks here, but I think generally would follow our standard that you want to have. That if you're in a open environment such as your hallways or an area where there's going to be people where they might interact within that 6-foot space, and a lot of times I just use 10-foot space to be on the safe side. And if you're going to have folks there, then they should be masked up. We may have some employees that are refusing or are uncooperative in that process, and we are allowed to place those requirements on them. And if to the extent that they don't comply, use your discipline process to remind them of the need for them to take proper infection control. So some of those difficult employee issues is what we're dealing with, and what I would call fearful as well and non-compliant. The other areas we're seeing legal complications. Well, one is around leave. If you've been tracking that, the Family's First leave benefit that's out there, and those apply to smaller employers, not to our larger employers, 500 or more. And so it has both this dual side in that it gives an employee a right to take time off, as well as gives us a tax incentive to allow it. And so we see claims under that. That leave benefit is largely for people that are being evaluated. And I think the evaluation period, Chuck can probably comment on this. I think the evaluation period has gotten tighter. We have more tests available. It was there for a while where someone might have some symptoms. They were being evaluated. They were being asked to stay home and self-quarantine. And the Family's First benefit would apply to them as they were going through COVID protocol. COVID protocol, I think, is moving quicker than it was a few months ago, such that people are more likely to be tested and probably have a quicker turnaround in terms of getting that information as to whether they in fact have coronavirus or whether they do not. And so that leave has shortened a bit. The most dramatic portion of that leave bill is that it allows leave for people who to care for their kids, have the need to care for their child, if their school's been canceled. Well, we know we're out of school session right now, and so we still get some leave requests based upon daycare closures, and or we're seeing some now with camp closures. The standard from the Department of Labor has come out saying it's a pretty tight standard to prove that if camp's been closed, that in fact allows you to stay home with your child. You're going to have to demonstrate that they were enrolled in that camp and that it was your child care option. Likewise, there's a lot of opportunity for you to communicate with those employees and find out what their options are. You can help explore with them child care options and help find those options for them. And so it gives you a lot more leeway than maybe what we initially had in that statute, but we do see some of that interaction and some of those claims. The other thing we're seeing is around the ADA, employees who may not want to return because they have a medical issue, some that may not want to work and be in the work environment because they're older, because I know it impacts an older person more than it might a younger individual. And so we have some guidance out of the EOC on that topic, in that we need to take our accommodation process pretty seriously. And so to the extent you've developed all your infection control, and now you have an employee that says, gosh, I've had lung disease and I'm at particular risk, and should I acquire the virus, I'm at really high risk, and so I don't want to return to work. That's what I'd like. It's probably difficult for the employee to claim as accommodation work from home unless you've allowed that and all the job can be performed there. But you will have to go through the dialogue with them and figure out what other accommodations we can make. Can we set up the job and the entrances and their work environment such that they don't have to interact with people within that 6 foot range, right? They can stay masked up. They can stay in a private office area where no one else is touching anything. They can stay the 6 feet plus from all other workers. You know, can we develop some of those additional accommodations for those folks? So we are seeing a fair share of accommodation requests from people that are nervous for a very valid reason, and that is their health might be greatly impacted should they come up with the virus in that regard on their own. And so we're seeing those types of issues. For the office environments, we're kind of seeing this 3-stage. I know that that you're in your phase 3 now, but from an employer standpoint, I think if it's an office type environment, they're looking at how do they reintegrate and bring people back, keep them safely spaced. If I'm in an office zone, I might be looking at the one-way hallways. I may be looking at added protection, whether that's plexiglass or additional walls around cubes to isolate people in the air. I'm looking at my air systems so that I'm not circulating air that might be infectious around the work environment, looking for ways to filter that. I'm looking at the private offices and seeing who I can isolate into those private office spaces when they enter. I'm looking at masking for those zones where I might have to cross over. We're looking at restrooms and making sure that maybe only one person or 2 are there at a time. All your cleaning supplies, right? You can provide every person with their own spray bottle and set of paper towels, which they can wipe down anything they come in contact with. Lots of opportunities for hand washing. Can you create additional hand washing stations and or hand sanitizer, more frequent stations around that to try to prevent touching, maybe limiting the use of the break rooms such that people need to bring their lunch. It has to be in a sack, no more congregating in the microwave, no more congregating around the coffee pot. We're just not going to have those resources available to people right now. So I think going through and having an evaluation of your entire office space of where people interact and where you can limit that infection control is critical. And if we're ever challenged, whether that be a work comp claim and they're trying to prove it happened at work, whether that's a reckless disregard claim saying, hey, I acquired it at work and that was reckless because you didn't have the infection controls, whether it's a customer complaint or whatever it might be, by having that demonstration of your actions, that's going to help greatly. I would recommend documenting that, not only putting in a document to communicate to everybody, but also documenting all the steps you're taking. To the extent that somebody has a concern about return to work, we can communicate that to them. Here's all the things that we're doing for infection control. Be very open to, hey, if you have other ideas, let us know. We're willing to consider all of those to how we interact and try to reduce the amount of infection contact that we might have either with each other through the air from meetings or whether it's through contact with surfaces. We have to take all those kind of steps, but it really requires a self-evaluation. I think declaring someone in your office the infection control person is critical. Allow them that extra time to study up on the topic, to take these steps, to acquire the resources you need in terms of cleaners and paper towels and the extra hand sanitizer and the masks, all those things. If you can allow them those resources to do all those things, I think it's very, very, very helpful. So we're seeing a bunch of that. With regard to your comment there about changing workplace, we are seeing the workplace change. I have a number of businesses that are looking at if they're possibly a smaller environment, or maybe looking at not continuing with their lease and rent, but rather they're looking at possibly reducing their office space and allowing more people to work from home because it's been effective for them. We have a number of even larger environments where people are all working remotely. It's largely an office zone, and they're extending out their return to work until after they believe this is all past, until there's vaccine put into place and they believe that the risk is low. And I think they're doing that for a couple reasons. One, they can. Two, it gives their employees assurances. They feel like they're operating just fine. in the way that they are. And I think a little bit of community care, if you will, that they're saying, gosh, in our work environment, we have this privilege that we can work remotely. So why not reduce the amount of impact, amount of interaction our people have with others at work to help not only our own environment, but also the community, and to reduce the exposures that might be out there and available. So we are seeing some change in the workplace. Something that we see a lot in these ADA type accommodation responses now is that people are saying, I've been working from home for 8 weeks. What's the problem if I do it again? Right? I have an illness. I'd prefer to work from home. That's what I want for my accommodation. So I think it's pretty critical that you communicate with folks about what the essential job functions are. You probably want to figure out what those are if it involves working from in the office, so that you can communicate that. I think to the extent that we allow people to work from home, I think you're going to want to remind them that we don't believe all the essential job functions can be performed there. So as to open yourself up to risk, you might have to accommodate a good share of your workforce working from home under that Americans with Disabilities Act standard. And so trying to have solid job descriptions about what's required to happen in the workplace, I believe is critical. And I think generally employers believe it is more beneficial to have people under one roof in terms of interactions, evaluations, maybe a little bit of motivation with regard to work ethic. The other issue we're seeing, and then I'll be quiet so we can ask questions, is coming back to school. You know, as we're watching what the schools are going to do, we have a fair share of the workforce who have especially little ones at home, and I think they were impacted greatly when school went to a home environment. And when you have 6-year-old, 8-year-old, 10-year-old, 12-year-old at home trying to learn and go to school, that involves a lot of mom and dad type of time and interaction and help with either teaching or guiding or keeping things going. And so I think we're watching what the school standards might be for return to normal school sessions, and whether we think our kiddos will get back to school, whether that's going to be partial weeks, full weeks, different schedule, different hours, and how that might impact your people and daycare operations and your workplace in terms of availability of the workers. And so we'll see how that all interplays with our return to work, regardless of what the phases are. We know we've got lots of kids under one roof, and kids seem to interact more closely than do adults. It's easier to put a mask on an adult in those spaces and get general compliance and have them not touching each other and not coming within the 6-foot space and operate in a pretty effective way. It's more difficult probably with kids, especially if you're talking elementary children, as to how you keep them all spaced and allow them to do that. And with kids, you recognize that, or you coached a little league team or something. That's just how kids interact. And so that's going to be a challenge, I think, for the schools, and we'll see how that interplays with our workplaces.
Well, very good. My goodness, you have seen a lot. I mean, just the gamut of all the issues brought forward that you've outlined for us. And I'm sure some of our participants on the call here can relate in one way, shape, or form to those different types of scenarios. And I appreciate both you, Scott, as well as Chuck, for your time and setting the stage for what we hope will be a good conversation here. On this Zoom call, there's a chat feature. If you haven't used that before, you can certainly unmute and try to ask your question. If you're asking at the same time, sometimes you have that overlap of asking. You can feed that question in through the chat, and I'll try to watch and monitor those and feed them back into the discussion. But I do think it would be good. That's why you all signed up for this. If you had questions for either Chuck or Scott regarding what you are experiencing as a business owner or employer or worker, I guess now's the time to start asking them. And if you don't have questions, you know I do. I always do. Any questions out there for them? Hearing none, and just a side note, we have about 33 people on the call here. I'll start first with a question for Chuck. When you were showing your slides, Chuck, and you talked a little bit about the positivity rate, and I just get very confused when I look at some of the data and everything. And then I like the risk, because that's really what we're talking about, is what kind of risks do I want to take as a consumer or as an employee? What risk will I take, and what risks, what kind of outcome or consequence? But in that risk new dial, it looked like Platt and Colfax were both in the yellow. And yet Colfax, from a positivity rate, was a lot higher. They were almost 50% higher. So is the risk based upon or assessed by the number of cases? Is it based upon the positivity rate? Are we, I guess maybe try to explain a little bit more of the positivity rate and what that really means to the dials, because we latch onto those and we say, oh my gosh, we're in the red or we're in the yellow. And I guess I just would like a little more clarification.
Yep. So the answer to your question is yes. So there's about 7 or 8 different metrics that go into providing the objective sort of position on the dial, and we're just rolling this out now. There's also a subjective side of that dial. So those same questions. So things like what is the overall, or I should say from the beginning of time, positivity rate, and what is the current positivity rate? So what you're seeing in terms of Platt and Colfax being about the same is you're looking at a bit of a ceiling effect. So anything over 15% is considered to be, for that particular metric, positivity rate is considered to be a red metric. So you could dial each one of those and say, is that high or is that low on a 4-point scale? Having a positivity rate over 15 is in and of itself high. In terms of number of cases, the risk assessment dial, and to be honest, the risk assessment dial is going to be the best tool that folks will have to understand what's going on, and because it will aggregate all of those factors. You just have to look at the dial and say, are we green, are we yellow, etc. I mean, at this point, provided that, I mean, our biggest risk right now is out of state travel from these hotspots that Scott was kind of talking about, what we're seeing nationally. Places like Florida in particular, Texas, Arizona, California. Was on a CDC call.
New York.
Yeah.
New Jersey. Yeah.
Yeah. It was on a CDC call earlier this week, and all of the major increases are being seen in just a handful, about 29 different health districts, nationally. So, which is right in line with some of the other data that we're seeing. Something like 80% of COVID cases are spread by 10% of folks. We call them super spreaders. So people that refuse to wear masks in public and these kinds of things. Yeah. So so to answer your question, Dean, there's just a lot of factors that go into positioning that dial up or down, and it's sensitive enough to where if you're at a very low level, right? So your positivity rate is low, like we're seeing in Boone and Nance counties, with no cases over the last few weeks. Just a few cases will cause that thing to spike upward pretty quickly. So you can move from green to yellow, and it just kind of lets you know, hey, wait a minute, there's a problem here. And so all things to pay attention to on that.
Good, thank you.
Yeah, let me jump in on that. I on the issue of super spreaders, I see a decent number of folks who are symptomatic, who are attempting to show up to work and not tell anybody. So we have employers, you know, that we under the ADA rules for medical testing, we're generally not allowed to medically test current employees, other than a few exceptions. One is you have direct information that because of medical reason they're not performing their essential job functions, right? So I see somebody and they're not lifting what they need to lift as part of the job. I think there's an issue there, and I'd send them out for an evaluation. Or I think there's a direct safety threat to others in that I observe their behaviors and think, gosh, there might be an issue. The EEOC has come out and said, because of the pandemic status, that we all essentially pose a direct threat related to COVID. And so we can test people for their temperatures at the door. And the CDC has a set of guidelines there on how you need to do that. You need to have somebody in the appropriate protective gear to test people, or behind a set of plexiglass. They have the procedure for that. So you're going to want somebody trained to do it. I think a number of organizations have contracted with local healthcare providers to provide some of that testing at the door. But we do have employers spotting folks at the door and catching them as feverish. They know they are, and they're just choosing to come to work. Otherwise, we've had folks that the employers have know to be positive, and then we spot them interacting with large groups of people. Either somebody else spots them in the public or elsewhere. So we know we have folks that are disregarding their, what we call their quarantine orders, or their guide to stay home, and or the guide by their employers not to show up. And so we do have some of those people that are living a little bit riskier, which means I think we've got to put in our precautions to try to screen those folks out.
And yeah, Scott, I was just going to say, Scott, we're absolutely seeing that, you know, locally here. You have the situation just as you've described, where someone is symptomatic and they've decided to, you know, go to work and get screened out through a temp check or something similar.
Yeah, and I'd be interested in what you've seen, Chuck. I mean, it seems like some of the national data, it looks like the folks that are positive, the ages may be moving downward. And if I catch some of the information, they're saying, gosh, you know, the idea of going to bars or to big parties and standing face to face to people where you might be talking loud because there's music or singing or hanging out, those are really not great choices. And it seems like we have folks doing more of that, at least on a national scale and in some markets.
Yeah, and it's true here in the state that that the positivity is moving to the lower end of the age spectrum as well. So we are seeing it.
Good discussion. We have a question about waivers that could kind of relate to this too. Can you require or ask employees to sign a liability waiver if they are comfortable with the precautionary measures that have been implemented by their employer?
You could have them sign a statement that says I'm comfortable with the precautionary measures. You can't sign a waiver. So waivers work backwards, right? If I'm going to, let's say I run into you with my car, right? So I hit your car, you got some damage, you take it off to the auto body repair, and there's $1,000 worth of damage. And so I write you a check for $1,000, and you write me a release and waiver back. For that past action, you can release the claim, and there's a waiver and there's a release. I cannot, though, however, you and I get together and I say, hey, I'll tell you what, I'm going to give you $20. And you sign a waiver and a release that if I ever hit your car in the future, there's no claim. That's not going to be valid. So I can't have an employee sign a waiver that says, hey, if I ever get COVID, you know, I'm not bringing any claims. You could have them say, I understand all of this. Here's all the precautions we're putting in. I understand it all. If I have additional input and ideas, I will share it. And that I'm comfortable with what you put in place. That I think this is a good program. You could do that in hopes of maybe trying to gain something on a reckless claim later to say, oh, you know, you're saying that we were reckless now, but back then you said it was okay. I suppose you could do something along those lines, but generally the waiver itself is is not going to be valid. We've seen similar type paperwork for daycare, you know, that if I was going to, especially as we started to reintroduce, if I was going to, I needed to bring my kids to a daycare environment because I needed to go to work. We knew the rates were decently high. We're going to put all these kids together in one room, and kids are going to touch each other, right? We're going to do our best not to, and we're going to do our best to put infection control. I have had those kind of operations have the parents sign off to say, look, I understand there is a better alternative, and that, you know, in terms of safer environment by staying at home and isolating, that there's some inherent risk of all these kids hanging out with one another, and that I understand that risk. It's not necessarily a waiver of claims, but it's some acknowledgement that they understand that there's at least some level of a risk for that behavior. So you can have either acknowledgements of some risk, if you will, or a statement that, hey, I think I'm perfectly comfortable with what's going on, and seeing if that gets you some ground later. It may not be much more than the paper you put it on.
Thank you. Along that, again, I'm kind of going to go back to where you said if you're an employee, perhaps is trying to deviate the system. And I've heard that before. I know that they're going to take temperature checks. So I've got my little jug of orange juice or my pop can, and I'm going to put it on my forehead. I'm not feeling very well, and I'm going to walk. I'm going to do that before I get my temperature checked, because I know I need my job. I need my check. We've heard that happen before.
Yeah, yeah.
From the employer's standpoint, is it kind of a 1, 2, 3 strikes, or is it more of you use the policy you have in place, or do you have to write a separate policy for what actions you're going to take as an employer? What's your guidance there?
I've been more broad to say, gosh, here's all the symptoms. You need to disclose to us if you've been asymptomatic, if you've been symptomatic in any of these things, if you've gone for testing, if you've been tested, or if you're positive. And oh, by the way, if you don't disclose any of these things to us, and it's happened, then it's subject to our disciplinary. You can be subject to disciplinary action. And I guess if I suspect that if someone deliberately tried to modify their temperature to get through the screen and going to walk through and put people at risk, they're probably not going to have a job the next day. So depending on what it might be, you can look at the misconduct, if you will, and judge that on your own policies. But I don't think you need to put out a detailed policy that says, oh gosh, if you lie about a sore throat, that's only a warning. But if you try to manipulate the temperature gauge, that's discharge. That's probably not going to be something you need to do. I think it's going to be broader in terms of if you fail to disclose. So we've had lots of employers with travel restrictions telling folks that if they go outside state lines, that they need to report that. And then depending on that employer's policy, some have had outright quarantine obligations that you have to sit it out for 14 days if you crossed into certain states. Maybe it's a hotspot state, or if you traveled internationally, or some even have said if you cross state lines. We've had some that have required disclosures for mass interactions, right? Are you going to a party or a concert or an event where there's 20 or more people? You need to report it. And our infection control chief who's evaluating this will determine whether you're safe to return or whether you're going to need to quarantine. So we can put a number of policies out there that require people to self-disclose not only symptoms but behaviors, and then judge them accordingly to try to protect the environment.
Yeah, that's a hard one for me. It kind of goes back to that social media when we try to teach kids, be careful what you put on social media. You know, that same type of, and we're a small community, you know, so-and-so was here or there, you might post something online and people watch one another so much. From an employer standpoint, that's their private life, and yet back to, you might do everything you can inside your walls as an employer, but you know what they do with their lives outside can come back to the workplace. So
yeah, there's no doubt about it, and I think as employers, we're asking about people's personal lives more than we normally even want to. And I saw somebody pop up in the chat line, can we ask people to self-quarantine if they've gone to a hotspot? And the answer is absolutely yes. You can make your policy that if you travel to any of these zones, you have to report it to us. And that if you do travel to one of those zones, we're going to have you quarantine, you return. And normally people will either take that as PTO time or take it unpaid. So I would notify them in advance. You want it in a policy such that if they're going to make that decision, so they come to you, they say, I'm going to travel to this county in Texas, it's a hot spot, and we can say, okay, you can go, right? We're not going to stop you from going, but if you do that upon return, you're going to have to sit it out for 2 weeks while you go through kind of a self-quarantine. It's not a legal quarantine, it's self-quarantine, while we make sure that you're not bringing something into the work environment. So we certainly can do that. And you can do, like I said, you can do it for other behaviors. It seems like early on, it was all about travel. Now I see a lot more employers putting in these behavioral components about interactions with larger groups of people. If you go to the med centers, Nebraska Medicine has put a similar dial gauge, as I see Chuck put up, with regard to certain behaviors. And you can go evaluate, your own interactions. If you're going to travel this summer, you can put in answer the questions as to what you're going to do and how is it going to work. And they'll give you a scale of whether that's going to be a risky travel behavior or a less risky travel behavior. And so they're trying to give us all guidance on what that might be. And we can certainly put some of those behaviors into our rules.
Did you see the accompany part to that question?
I missed it. I'm sorry.
Oh, no, that's all right. You answered the first part. The second one is, how do we determine what locations are? They talk about it in the media, but how do we know that which ones are a hot spot?
Gosh, maybe I'll let Chuck answer that. I've been using the CDC mostly. And the problem is it's constantly been changing. For a while, employers just had state line rules. Well, if I was going to travel across the state line into Colorado and camp for the weekend in a national park, probably not a lot of risk that I need to sit home for 14 days. If I'm going to travel off into Colorado, which I don't think is a particular hotspot, maybe Chuck thinks differently, but if you're going to travel there and now I'm going to go to a family reunion with 100 people, and oh, by the way, we're going to have a buffet and no one's going to be masked, that seems to be a high risk. So I guess my thought to it is maybe we try to evaluate these situations as to what the risk is about them. But there are certainly some very hot spots, and maybe Chuck can tell you where to find those particular red zones in, as I've kind of just watched on CDC, it looks like some New York zones, New Jersey, some Texas, and Florida. There's places there that look higher risk.
Yeah, and I think Scott just nailed it. Early on, when things were moving pretty rapidly, we felt pretty comfortable putting out recommendations for quarantine for hotspots that we would identify based on the current epi data. We know that where we are now, the state administration's not interested in doing any sort of state mandated quarantine, and we likely will not recommend that either. However, we are making strong recommendations for people to not travel to those hotspots, and so it's shifting. There's probably a few that we could peg right now that'll likely be still worrisome here in a few weeks, but I think that becomes the harder problem, right? I mean, that would be one thing for East Central to say, we recommend not traveling to Florida for the month of July. But at what point, do you translate the guidance into policy, and at what point was that recommendation made? And, that gets a little bit complicated. True story. I won't name the business, but there was a shift manager had gotten a hold of my cell phone and had called me to ask me to bless their family camping trip to Idaho, and had gone so far as to plan out exactly which counties based on the epi data where they would get gas, and wanted me to bless sort of like the Pope where they might go and talk to HR. But I don't know if those are our recommendations have been common sense, right? So I think exactly what Scott was talking about. A camping trip to South Dakota is not a high risk. And I would take that on a case-by-case basis, but I certainly would have situational awareness of where folks are going. If someone says, "Oh yeah, I'm gonna fly to Florida," that's a much different situation than a camping trip. So I would just keep that situational awareness and deal with that on a case-by-case basis.
Yeah, and like I said, in terms of like a checklist, that Nebraska Med, I think, came out just yesterday with kind of a checklist of items you can look at it. So for example, travel, like Chuck mentions, well, flying's more risky than is driving. So you can have restrictions on flying potentially. Some states are going to be hotter than others, and you can find that on the CDC website of what are hot areas. There's the COVID tracking project online. You can look there. I think you can look on, I think the state website has a decent share of that information. As does Nebraska Medicine. So you can look at those places for hot spots and concern areas. You can also look at, like I said, the behaviors of that travel as to what they're going to go do and who they're going to interact with and how they're going to interact, as to whether that's high risk or low risk. And I think you can encourage that of all your people, right? I think you're getting more of this information out to say, hey, we're taking this stuff seriously, and you may or may not, but it's serious to us and it's a requirement for your position.
I have a little bit of a framed question. Looking at the data, thank you both for that. It leads me to think of phase 3 to phase 4 and the data that Chuck showed in his slides, because I was looking at Memorial Day. On the news, they say that people got together on Memorial Day or Mother's Day, and then they saw some peaks, spikes after that. And looking at the data, it actually looked like we saw a spike right at July, or the 25th of May, and then up through the first parts of June. But then I hear that you really see that impact about 2 weeks after, or 10 days or so after everybody's been together. So I'm coupling this is a long-winded question, but taking that data and then looking at the red, white kaboom and the community celebrations, we've been trying to emphasize, not the smaller groups and that kind of thing. But if we were to see a spike, we're in phase 3, whenever we see that spike, then as a state, what is the discussion, or even as a community, for experiencing what Texas did, where all of a sudden they saw such a spike that they're closing down businesses again, or they're closing them back up. And for a business, that's so darn hard. And then because we have one question after mine. So take a short answer for mine to the long question, and then we'll ask who had Heidi's question in the queue.
Yeah, I could talk about the DHM piece. So the way they're structured now, so each health district, there's 19 of them, they each have their own DHM and potentially at a different place. So we're currently in phase 3. However, and I'll be clear, the metric that Governor Ricketts is looking at whether or not to move forward or to move backward in time in the phases is related to our sort of hospital capacity. Now, I think we're all pretty much in the same boat that if the cases are such that they require complex treatment, you're looking at transferring those patients out. So that to Lincoln or to Omaha or something like that. So that really maintains a high hospital capacity in each of the local health districts in the state, and then ultimately Lincoln and Omaha sort of faces the bottleneck or that crunch as things get bad. So it's been our experience in our health district. The other factors have not factored as much into it as that healthcare piece. And then what was the first part of your question?
Well, I was just looking at the data. It didn't look like we saw the spike that I anticipated we would. So just kind of.
Yeah, and just quickly, what has, and just sort of glancing at it, we've got to get a little deeper dive into those data. But the one predictable thing that we've noticed is at every DHM change, there's been a little bit of an uptick. as behavior change. It's like, oh well, this is recommended. It hasn't, we haven't seen major spikes, but you do see a bit of an uptick, right, after every DHM change, about 7 to 10 days after that policy change.
The question in the queue reminds me that the whole idea of Boomerang, again, is to share amongst businesses, that I extend out to you and you give back to me, and that we are that type of business community and environment. But the question is, how are other companies handling their annual summer company picnics? We are canceling ours. However, I want to keep the team morale up. So this would be a good group discussion if others can chime in, and then certainly have our experts weigh in on either the risks or maybe some what other practices are, or maybe just some ideas. So how are other companies handling their annual summer company picnics?
Okay. I guess I'll start with what I've seen with a few folks. A decent share just canceling. It's too hard to put all those folks, bring their families, have all that interaction and all the fun things that they normally do at those picnics involved, people getting face to face. So they're just not doing them. I've seen some folks do like a drive-through picnic, preparing, having the meals prepared and people drive through just for labor relations, if you will, to provide people a picnic night. I had one organization do it spread out. So drive through, pick up your meal, put down the tailgate. Everybody sits, within their family units and maintains proper spacing. And, you've got a big tailgate party essentially with everyone isolated in their own zone. The key seems to me is you keep them distanced if you're having an event at all, and all those things that might be fun about it. You might be able to have the the 3-legged race or playing cornhole or whatever you might be doing, because you can't have people interacting that way.
Thank you. Other questions or comments on that one? Any other change of mindset or not mindset? Any other change of topics that the participants want to bring up? Not hearing any. How about Sandy Fisher is also on our entrepreneurship committee, and Tanya Wemhoff is here as well. We've got, again, a small business owner. You deal in HR issues. Any thoughts that you might put you on the spot? Any questions that you might have?
Not on the top of my head that I can think of at the moment.
I'll throw questions out. Hey Chuck. I saw a piece the other day that suggested that younger people, like, small children, maybe weren't even acquiring the virus at the rate of older people. Have you seen anything along those lines, or do you perceive that to be true?
1 second. So there is some evidence to suggest that that's probably true, in the fact that now we're seeing a higher infection rate amongst younger people. The other thing that's relevant to that is there was an article that came out in Nature, I believe it was last week. So to the topic of antibody testing. So we really thought that antibody testing was going to be a really good tool and really help us. The problem that we're seeing is the amount of antibodies that are produced seem to be correlated with the sort of severity of the virus in a particular person. So since we're seeing such high rates of folks that are either asymptomatic, very lightly symptomatic, or pre-symptomatic when testing positive, we're coming to find that those people have a very short amount of sort of protection through immunity to the virus, and that because of that, there was a lot of early data out that was kind of conflicting among studies. suggesting reinfection and that kind of thing. Well, now we know why. If you've been infected by the virus and you've had very few symptoms or very light symptoms or have been asymptomatic, your immunity drops off over a very short amount of time. So you've seen, another indicator of this is the announcement here just a few weeks ago that the vaccine is going to be at least a 2-part series, similar to the old polio vaccines, where and that points to some pretty short antibody generation from the virus. So we're looking at a very short period in which antibodies are currently present. In fact, some of the in that Nature study I'd mentioned, some people when they had gone back to test, they didn't even have antibodies in their system, which would point to reinfection possibility.
And we've had a number of employers that have wanted to do, I think early on from that kind of philosophy, wanted to do antibiotic tests. The EEOC's come out and said there's no correlation to work or even give you much data, so you're not allowed to do them as an employer just to make them available. I have had some healthcare employers that have made it available to people just if they wanted them, and allow that to go into the data pool for analysis. But as an employer, generally, we cannot require an antibiotic test.
Yeah, it's not as helpful as a tool as we thought it might have been.
Yeah, I think it's probably good for the research, but it doesn't help you much for your workforce.
Another question that came in: what standard are companies being held to related to the ADA if employees are afraid to return to work to being at a higher risk according to the CDC standards? What would require that employees request to be considered under ADA? And I'm reading from the chat if not everybody has opened it up.
Yeah. Well, with the ADA standard being so low, virtually anybody with a medical issue is disabled. So I think you have to just kind of consider them that way. I think the big question around accommodation is, if somebody's been working from home, are you required to allow that to continue if you're returning people back to work? And we don't have much in terms of any guidance on that. We don't have any cases. No one's been sued on that line. We know that working from home can be a reasonable accommodation. We do have cases that tell us that. We also know that working from the office might be an essential job function. So if working at the office is critical, if it's part of your essential job functions, if you can outline what those are and what those obligations are, then I think your requirement, if somebody has some medical issues that might put them on that higher risk group, is to determine and communicate with them. You're supposed to go through the accommodation dialogue and figure out, can we do some additional things to protect them? So for example, somebody says, gosh, I've got one of the ailments, I'm diabetic, I'm concerned about coming into the office environment, I've been working from home, I'd like additional accommodation, I want to work from home. You say, no, the job is in the office, it's critical to us because of a number of things, and you've sorted out what those are and can communicate that. Then I think you can start to look at, well, what can we do for that person? So for example, you might start them on a different schedule so they can walk in the building when there's not other people walking in. You might have them leave on a different schedule so they can exit when they don't have to interact with people. You might change where their office is located such that it's isolated and away from people, and no one else enters that space. You might have them use a separate entrance. You might have them stay masked up the entire time, even in their cube space. You might not allow anybody to enter into their office, such that there's never anybody that interacts with them within the 6-foot zone. So you can try to put in extra precautions that you work out with the employee and attempt to accommodate that and create an even safer environment for that person than what you're already doing for everyone else. But you are required to go through that accommodation process.
Observation is the more we move to phase 3, the more people are becoming relaxed and about the guidelines. Are there suggestions to combat that mindset?
When we figure that out, I would love to know. We try to remind people that, and that and this isn't a fair statement, but I would say that, political decisions are not public health decisions. However, that suggests that the moving through phases isn't necessarily related to what we're seeing in terms of our public health data, and that's not true. We just need to continue to be vigilant. I think the analogy I like to use, it's when you're losing weight, it's really easy to lose the first 5 pounds. It's the last 5 pounds that are really hard, right? And so that's what we're trying to do right now, is lose our last 5 pounds, try to get out of that 2-3 cases per day. We just need to, we should step things up at this point. We should be more vigilant with our mask wearing. We should be more vigilant with our social distancing, so we can, kind of finish this thing off, at least for this cycle, and, get to a point where we can feel, a little bit more, confident as we reopen even further. We want to make sure schools start on time. We want to make sure that we don't move backward instead of forward. No one wants to go back to where we were. We have to continue to wear masks. I think mask wearing is, if there's one thing people get out of this today, is consider mask wearing, because it's not always going to be feasible to do 6 foot of distance in all scenarios. And so if you're wearing a mask, it really mediates the way folks do. And I kind of like, the way Scott was talking about a lot of the behaviors at the work environment. That's really the way to think of it. We think of things through the lens of contact tracing. So if we have to go back, if you have a COVID positive person, how do we, going back through and understanding who was exposed, right? So mitigating the exposure as much as possible, actually reducing the number of people that could have possibly been exposed. It's those two things. And if you always think in that lens, so that affects how you think about hand hygiene and office meetings and those interaction pieces. I think all of that helps. But yeah, we need to continue to come together as a Columbus community. I think we've done a really good job. We just need to continue pushing that message, all of us, pushing that message that we're not done yet, and that we need to carry it home.
Yeah, gosh, that's great stuff. I guess I have a couple thoughts in that regard. One, while it might not be a legal liability, it's certainly a business liability. So Chuck's observation on the contract tracing, if you have folks separated and you're doing the masking in, the hallways or areas where they might be within 10 foot of somebody, right? And I'd have been going by 10 foot because it's safer than 6. And you're doing these things, now you have someone who's positive. And so you wake up on a Tuesday morning, you have an employee that calls and say, hey, I had some symptoms. They connect with your local provider and they do a teledoc. They say, gosh, or they go through the Test Nebraska, and they go through the testing process and they're positive. Now you've got this situation where you need to communicate to those around them. It's much easier with all those precautions being put in place to have now to tell the workforce, hey, we had an employee, they've tested positive. Here's what we're going to do to clean the zone. And if it's isolated, it's easier to clean. If it's not so tight within the workplace, you don't have to send everybody home, right? We've had workplaces that have had to shut down for 3 days while they go through their cleaning service and to let a 3-day pass to try to let the virus die that hasn't been cleaned. And so to the extent that you have these precautions in place, it gives you a greater ability to isolate a section of your real estate to have cleaned. It allows you to isolate potentially who you send home and be monitored. It allows you to have fewer folks on contact tracing and have been quarantined. So that's all advantageous for you to keep your business going. So that's my one observation. The other one is with regard to information. I think as a business owner and as the employer, going to those places where you find great data, valid data, whether that's the state or CDC or from OSHA or from the COVID tracking site or from Nebraska Medicine, whatever it is you like, there's great places for info. if you would go on Nebraska Medicine site, and they have a video currently now with what's it look like when I talk, and what does that produce in terms of the particles in the air compared to when I have a mask and when I don't. That's great information to share to employees and say, hey, check out this video. This is why we're wearing masks in our open spaces, right? So I think communicating with people from valid sources, because there's, in today's world of social media, there's just a lot of garbage out there. And so folks are reading that it's all a hoax. Folks are reading that, you know, we're all going to die. You've got these things in all these spectrum that's hard for us for people to figure out. So I think bringing them to the kind of what I'm going to call central information, good, valid information that they can take home, protect themselves at home, protect themselves at work, engaging good behavior to try to reduce any exposures and still have some of the fun they want to have. I think that's where you want to be as a business, is to try to be a guide in all of that for your people, and that should help both in terms of your work environment as well as people's personal lives.
Thank you. We got 2 quick questions. We got 5 minutes left, so I'm going to go to Anya, and then there's one more question in the queue.
Maybe this is kind of crazy, but Chuck did mention that with the antibodies, there's a degree of the illness. Now, the tests don't test that. Either you have it or you don't, correct?
That is correct.
Okay, Chuck, can you share why the 10 minutes within 6 foot versus if just within 6 foot distance for a short time? Is it just a probability issue?
So actually that CDC data has been, or that CDC recommendation has been updated. So it's actually 6 feet for 15 minutes now. Few months ago it was 10 minutes. It is partly probability, but it's mostly dose response. So we've come to find that as we collect more data on this virus, being exposed to more virus increases your likelihood of actually contracting the infection. So it's more about the dose response rather than probability, but probability is a part of that equation.
And I lied. I have one more question because I always have questions. So then this is probably too big of a question to ask at this late hour, but we're also hearing that people that might be showing signs of cancer, or they're avoiding going into the doctor, they're fearful of the situation, they're putting those things off, or they've put off the elective surgeries. So I've heard, we may see, it's likely we'll see an uptick of just a surge of cancer deaths, discussions of people who are in nursing homes who have seen a steadily quick decline because they haven't had the social interaction that they are used to. So just from a more of a hospital claim, as well as, or hospital, what we should be prepared for as a community, if that's true, that's what some of the experts are saying. And 2, would we see any law cases out of that? I waited too long because of somebody told me I shouldn't, and now I'm in a bad way, and I want to sue somebody. I want to take. Will we see any of that? Is that too? I gotta shut up.
No, I don't know. I mean, people could sue for anything, but it seems as though, I think that our healthcare organizations did about the best they could, and then did what they were told in terms of where they put their resources. Some people probably did delay that exam, right? If I was supposed to go in for my colonoscopy, that was canceled. And so you may have a 2-month, 3-month delay in what might have been a diagnosis. So we might have some of those scenarios, but I'm not sure those operations had any choices in how they operated. Kind of tough to sue the state or the feds for any of that, to say, gosh, it was a bad decision at the time. So I suspect so. I mean, you get lawsuits for everything, and there may certainly be some impact. I mean, I think with regard to your nursing homes, we know that a great share of our fatalities from COVID have happened in nursing home environments. And so I think the standards that the state and local health are trying to implement are really helping, putting in those standards for nursing homes, doing some more testing now that testing's available, and really trying to protect those vulnerable populations. You're right, the amount of social interactions declined, but gosh, the social interactions for those environments, it certainly is risky, and hopefully you're putting some precautions in now that allow some more of those interactions and also protects those folks more.
And on that note, I was just going to say, you both have been great experts. I would say as a community, we've been blessed with, I think, collaborative efforts to certainly take the East Central Health District taking the lead, working with the hospital, providing us that guidance. The city's been very cooperative. I know we've got lots of questions, whether it's on sports and whether it's on businesses, and just as we watch each other as a community. But I think these conversations can really help, and we are grateful to everybody who did participate. And I would say at 1 o'clock, on behalf of the Entrepreneurship Committee, the Boomerang meeting is at a close, and we are grateful for your participation, and hope you have a great 4th of July.
Thank you all for the discussion. Tremendous.
Thank you.
Thank you. Thanks, Scott. Thanks, Chuck. Thanks, our board. Thanks, John Boy.
Have a great 4th.
Yeah.